Hello guys, welcome back to another video. If you're new here, my name is Faith, and on this channel I talk about nursing and general leveling up. So if you're new here, thank you so much for clicking on this video. Please hit the subscribe button so that we can grow this channel together. So today I'm going to talk about what nursing agencies look for when they are recruiting for nurses to work in the US. Get right into it. So I've gotten so many questions about people asking me if they have to have a degree in nursing so that they can be a viable applicant for a nursing job in the US. And the answer is no. You have to have at least a minimum of a diploma in nursing from an accredited school in your country for you to be a viable applicant. Like so many agencies, they prefer diploma and above. You can be a diploma holder or a degree holder and you are a viable applicant. But there are few agencies that prefer degree nurses. If you have a BSN in nursing, you will be easily taken by those agencies. I think one of them is Shearwater. Yeah, they prefer degree nurses. So what you have to know is that you have to have at least a diploma in nursing for you to be a viable applicant when you are applying for a job or an agency, when you are looking for an agency to help you in the process of becoming a registered nurse. And the next thing that the agencies look at is your area of specialty. And this does not really mean that you have to be having a certificate in that specific area, but it is just the area that you have worked in for long and you are still working in. So many agencies prefer medical surgical nurses. They don't prefer nurse managers. They don't prefer the nurses working in maternity wards or then maternity units. They don't prefer pediatric nurses. They prefer medical surgical nurses. That's what I've seen, most of them. I think some prefer not really prefer, but they can take critical care nurses. They can also take nurses with maybe the specialty in renal nursing. Yeah, but most of the agencies that I've interacted with, they prefer medical surgical nurses. So when you are going to look for an agency, please at least make sure that you are working in the medical surgical unit. That will really favor you when you are applying for these agencies. Okay, the next thing that the agencies look at is your work experience. So they want to ensure that you are currently working as a registered nurse in your home country and you have a valid license. So what they want is you have to have not less than 2 years work experience, at least 2 to 3 years. Then they will consider you, because they want to make sure that you are in the field and you actually have accumulated at least an amount of experience that will also help you in transitioning to working in the hospital in the United States. So you have to have at least 2 to 3 years work experience. Okay, the other thing that the agencies look at is the bed capacity in the hospital that you are working in. So most of the agencies will want you to be working in a hospital that has over 100 bed capacity. So if you are looking to apply to an agency, ensure that you are working in a hospital that has more than 100 bed capacity. That will also help them know that you can meet the standards of working in the US in a bigger facility. Yeah, they just want to make sure that you have enough experience. If you're working in a smaller facility, maybe the experience is not enough. You don't have enough equipment for you to put you in a level that you can work in the US. So you want to make sure that you are in a hospital that has over 100 bed capacity. That will put you in a safe place when applying for these agencies. Okay, the other thing that the agencies look at is your working hours. So you should be working, of course, you should be working in your home country, and you should be working at least more than 40 hours per week. Yeah, that's what most agencies prefer. I think that is the standard working hours in the US, at least more than 40 hours per week. So if you are applying for an agency, ensure that you are working at least more than 40 hours in a week. The other thing that the agencies look at, I think this is the last thing that the agencies look at, is your patient-nurse ratio. So you should be working in a hospital that you are at least catering for maybe at least one nurse, more than at least 4 patients, like one nurse 6 patients, and it should be primary nursing. So those are the things that the agencies look at when they are looking for nurses to recruit from other international countries. The other thing that the agencies look at, I think this is the last thing that the agencies look at, is your patient-nurse ratio. So you should be working in a hospital that you are at least catering for maybe at least one nurse, more than at least 4 patients, like one nurse 6 patients, and it should be primary nursing. So those are the things that the agencies look at when they are looking for nurses to recruit from other international countries. Okay, thank you so much guys for watching. Please hit that subscribe button so that we can continue learning from each other, and please leave a comment in the comment section about anything that I've left out that is crucial to applying for an agency. And also guys, soon I'll be filming vlogs, essential things pertaining to this program, pertaining to transitioning in the US. I'll start filming vlogs, so stay tuned for that, and thank you so much for watching. Bye.